Good day once again, Dr. Yakubu is my name, Wildlife Hospital, Abuja. Today we shall be talking about blood group, a particular type of blood group, and its relevance to us in our lives. Most of us are familiar with blood groups, what we call the ABO blood group system, but I'm sure a few people are aware of another type of blood group that we call the rhesus blood group. So usually in hospitals, when we group people's blood, you hear us saying you either have blood group A, B, AB, or O. And then in addition to this, sometimes you hear doctors or healthcare providers adding a positive or a negative to your blood group. In other words, you could hear someone say, my blood group is A positive or A negative, or B positive, B negative, O positive, O negative, as the case may be. So therefore, we have two general groups, okay, or ways of grouping blood types. So the first one is called the ABO system, where you will either be told to have ABO or A and B. And then the other one is called the rhesus group system. So the rhesus group is the one that you hear us talking about when you hear someone saying you have a plus or minus. So that one is either you have the rhesus antigen or you don't have. So for those who have the rhesus antigen, we say they are plus. So if you have a blood group O and you have rhesus antigen, then we'll say you are O positive. If you have blood group A and you have the rhesus antigen along with your blood group antigen, then we say you are A positive. If, however, you do not have the rhesus antigen, then you'll be labeled as a particular blood group with a negative. So if you are A negative, for instance, it means your blood type is A, but you don't have the rhesus antigen. Now, what's the implication of this rhesus factor, the presence or absence of it? Generally, the presence of the rhesus factor is not a problem, really. But when you don't have the rhesus factor, that is where you have some medical implications that we need to talk about today. Now, for those who are negative, what it means is that you are born with some kind of deficiency, let me put it that way, that you do not have in your blood. Now, the problem here is if you don't have it, anytime your body is exposed to any type of blood that has the antigen that is positive, if you are negative and you're exposed to blood in any form that is positive, or body fluids that has the rhesus antigen, then you're going to react violently to that blood that you're given that is positive. That's where the challenge is. So therefore, generally, people who are negative or who do not have the rhesus factor are very selective in the type of blood that they can be given. And that is where the issues are. Now, for men, generally, men don't usually have any challenge, okay, except that, of course, if you have no rhesus antigen, in other words, if you're negative of the rhesus antigen, all that you need to know is the fact that you cannot be transfused with anybody's blood who has the rhesus factor. In other words, any group, no matter what your blood group is in the ABO system, if you have no antigen, the rhesus antigen, you can't get from anybody except someone like you who does not usually have. Now, the challenge with that is people who are negative in any society, any environment, they are the minority. In some places, they are about 5 to 10% of the population that have. So it's sometimes very difficult. In fact, usually very difficult to find the negatives to transfuse you. That is where the challenge, the first challenge of people who don't have the rhesus factor, that's the first challenge. So in emergency situations where blood is required quickly, if you have the negative or if you are rhesus negative, it could be very difficult sometimes. In fact, sometimes impossible to get the blood type, because in that society or in that environment, you may not have people as much like you. as compared to those who have the rhesus factor. The second aspect where this is important is in women. Now, as a girl child, if you're born with a rhesus negative, then of course, apart from the fact that you also have risk of getting, these problems of blood transfusion, there's an additional problem that may occur later in life, in your reproductive life, whereby if you happen to marry a man who is rhesus positive and you are rhesus negative, anytime you get pregnant from that man and the baby in your womb takes the man's blood group with his positivity, then that baby will be considered a foreign thing, because anytime the baby's blood and your own blood mixes, knowing that the baby has carried his or her father's blood group, your body is going to violently react to the presence of the positive blood group in the baby, and you may reject the pregnancy. In other words, it's just like when we transplant organs, people reject it. It's actually a reaction to the presence of foreign things in you. So you may reject the pregnancy. In other words, you may have miscarriages. But almost always, however, when the baby is positive and you are negative, in most cases, the first pregnancy may scale through, may escape the reaction you are going to elaborate on the baby, because once your blood and the baby's blood mixes, in most cases, the time the blood mixes is usually around delivery time. Although during pregnancy, sometimes certain accidents may occur that will make your baby's and your own blood mix. But even when the blood mixes, you do not produce chemicals, in other words, antibodies that can kill the baby immediately. It takes a period of 6 weeks to about 6 months before the antibodies will be enough to kill the baby. So by then, the baby will have escaped. But where the problem is this: thereafter, after that first birth, every other baby that you carry with that man whose blood group is rhesus positive, your body is going to reject the baby from the very beginning. And so you see women having recurrent miscarriages as a result of that blood group problem. If you are in an environment where this information is not available, of course, people will attribute that to a lot of things. In practice, we've seen women who have had recurrent miscarriages. Now, the only exception to that is where, for some reason, if the baby you carry in your womb is rhesus negative, then of course your body will not reject the baby and you'll carry that through. But as long as you get sensitized, that is, if during the course of the very first pregnancy, your blood and your baby's blood mixes, particularly during labor or during cesarean delivery, you become sensitized. We call it sensitized. That means your body is triggered to react to subsequent pregnancies that you may have. And that is where the problem is. So knowing your blood group in this case is as important as any other thing for anybody at all, because apart from blood transfusion and your eligibility to different types of blood, for women in particular, it is necessary that every woman should know her blood group before she gets pregnant. By the way, that's one of the reasons generally in hospitals, when women come, we actually check for the first time during pregnancy. We want to check their blood group to be sure what they are. If we see rhesus negative women, we see that as a red flag. Almost always, we want to know, therefore, the husband's blood group at that time. If the husband is negative, well, good luck, that is fine. But where the husband is positive, then that baby in the womb, provided that is the first pregnancy, perhaps can escape. But where sometimes problems come is if a lady had had an unwanted pregnancy in the past, okay, and she did not know her blood group at the time, and she went and carried out an abortion. In the process of abortion, sometimes the blood can mix with the lady's blood and she wouldn't know at that time. Therefore, she may get sensitized. Once she gets sensitized, when she later gets married, and she's unfortunate to get married to a rhesus positive man, she may never have a baby for that man. Because once sensitization occurs, there's nothing anybody can do. Almost always is a lifelong problem. So the way to prevent sensitization, therefore, is first to know your blood group and be certain about it. Then next, it's even important that anywhere you go as an individual, let everybody around that environment, especially in medical circles, know that you are a negative, resource negative person. For reasons that when you come to the place as an emergency, they know what to do, how to source your blood. Then secondly, as a woman, as a lady, you should remember that anytime you get pregnant, you let them know that you're resource negative. Whether the pregnancy is going to end up in abortion or in delivery, immediately after the abortion or delivery, you are expected to get an injection that will prevent sensitization so that subsequent pregnancy will be saved. But we also have to know that as long as you keep getting pregnant and are getting them aborted or delivering them, within 72 hours of delivery or an abortion, you must take an injection called anti-D antibody injection, or ROGAM. That's the popular name of the injection you need to take within 72 hours. Otherwise, risk of sensitization is high, and if you get sensitized, then of course it's a lifetime problem. So by and large, this is the reason we need to talk about this blood group. So every adult, or every child for that matter, should be taken to a hospital, let everybody know his or her blood group. Is very important, for it could be just a life-changing situation, when the chips are down. Thank you.